So when I finished my clinical fellowship in consult liaison psychiatry, one of the things I did in my kind of my early career was I did a part-time research fellowship, and that for me was really a way to kind of learn about research and start to figure out if I wanted research to be a part of my career going forward. And so for many years, I worked with a group at Mass General called the Cardiac Psychiatry Research Group. It's a group of psychiatrists and cardiologists, and we kind of work at the interface. So we spend a lot of time thinking about patients who have underlying heart disease and the risks that conveys from a psychiatric perspective. And one of the things that I get really interested in is that there are many psychiatric medications that can have side effects on the heart. And in particular, there are many psychiatric medications that can increase the risk for somebody to develop an abnormal heart rhythm. And so a lot of the research that I do is kind of focused on that question, looking at which medications are likely to increase a person's risk, and what are some steps that psychiatrists should take in terms of monitoring that. So I continue to do a little bit of work with that group. And then more recently, in the setting of COVID, we've actually started doing some research projects related to COVID, and there's more and more coming out about neurologic and psychiatric manifestations of COVID. And so we currently have a couple of projects that are looking specifically at patients who developed psychiatric complications as a result of having COVID infection.